World Habitat Day 2025, observed by the Ministry of Housing and Urban Affairs under the theme, Urban Solutions to Crisis, highlighted India's flagship schemes such as MyUrban and the Smart Cities mission. But beneath the familiar concerns of pollution, heat stress and inequality lies a silent emergency: a steep rise in heart disease and diabetes across Indian cities. Cardiovascular disease has emerged as one of the leading causes of urban deaths, with prevalence almost double that of rural India and rising rapidly among people under 50. Long commutes, toxic air, disappearing green spaces, processed diets and constant stress have created city environments where simply living and working accelerates disease risk. Access to healthcare is also uneven, with private hospitals clustering in profitable zones, leaving large populations underserved as market forces outweigh public health needs. As India urbanizes at unprecedented speed, fragmented planning threatens to lock cities into patterns of sedentary lifestyles, pollution and widening inequities. Integrating heart health into urban planning is now essential. For decades, transport, housing, green policies and health systems have operated separately, resulting in car-centric highways, expanding fast food hubs and rising congestion. Compact mixed-use neighborhoods can cut commute distances, reduce emissions and encourage walking and cycling. Global examples from the WHO Healthy Cities Network show that when health is embedded into governance, chronic diseases decline. AI-enabled air quality tools, heat mapping and digital dashboards can further guide responsive planning. A heart-healthy urban model relies on interconnected pillars. Walkable streets, protected cycle lanes and shaded footpaths promote active living and reduce the risk of diabetes and hypertension. Green infrastructure cools neighborhoods, filters polluted air and lowers heat-related cardiac stress. Mixed land use and reliable public transport reduce dependence on private vehicles. Strong local markets and restrictions on junk food advertising encourage healthier diets. Together, these elements create neighborhoods that promote physical activity, cleaner air and community well-being. Invisible risks continue to threaten lives. PM 2.5 pollution triggers cardiac arrests, while heat-trapping concrete raises cardiovascular stress. Poor waste and water systems worsen metabolic disorders. Without urgent reforms, Asia could see a 91% rise in cardiovascular deaths by 2050. Equity must anchor all interventions because low-income groups face the highest exposure to pollution, poor mobility and limited healthcare. Preventing green gentrification requires equity audits and community-led planning. India stands at a decisive moment. With support from NUHM and major investments such as ADB's $10 billion urban program, cities can embed heart health into planning. Ultimately, the strongest urban solution is clear: design cities that protect the human heart.